I'm Lee Doherty Biddison.
And I'm Carolyn Kumsty Fowler, and we're your co-hosts for the Johns Hopkins Office of Wellbeing's podcast, Vital Conversations, Influencing Workplace Wellbeing in Healthcare.
We spend a lot of time thinking about how to influence workplace well-being in healthcare, and we're excited to share what we're learning.
Thank you for joining us. Hello, and welcome to another episode of our Vital Conversations podcast. I'm Carolyn Kumsty Fowler, and I am delighted today to talk with a colleague, Dr. April Satoff. April is the Vice President and Chief Nursing Information Officer at Johns Hopkins Health System. She has 24 years of nursing experience with 21 years focused in clinical informatics. She's certified in healthcare information management systems and nursing informatics, and has extensive experience in healthcare technology implementations, strategic planning, championing the use of innovative technologies, workflow redesign, and building and fostering teams. And she is a fabulous team builder. April is also interested in how healthcare technology can support well-being and professional fulfillment. April, I'm delighted to get a chance to talk to you today. Welcome.
Thank you so much, Carolyn. What a lovely introduction. I'm happy to be here spending some time with you as well today.
Thank you. Well, let's start off with some background, and I'd love to invite you to tell our listeners what led you to devote your career to nursing informatics.
So, I started out my career in pediatrics as a bedside nurse, which I absolutely loved. And after a few years, I was looking for a greater challenge and really trying to think of what was the next professional development opportunity for me. And the timing of that was fortuitous because the hospital where I worked at that time was kicking off a project related to expanding the current features of the electronic health record. And so, with several health systems and hospitals expanding in that area, they were looking for people to be engaged in that. And of course, being one of the younger nurses on the unit, the older, more seasoned nurses were like, "Hey, you're the perfect person to do this," and they asked me to join the project because honestly, no one else was willing and able to take it on. And so, I was up for a good challenge, and I really realized that I was interested in this very early on because developing technologies had that impact of touching every patient in the hospital. The quality, the safety implications, the magnitude of instead of just providing care to four or five patients, having the ability to provide care that essentially touched every patient in the hospital. I think I just realized that the technology was really powerful in where it was going, and I was excited to be a part of that journey. And so that was the beginning of my career in informatics and keeping the patient still at the center of any technology decision making. That philosophy, that passion of nursing, why I became a nurse, that stuck with me into my informatics practice today as well. So I love the blending of both of those things and realizing that technology has that ability to connect things and make things easier and safer and higher quality. All of that is really how my passion got me to where I am today.
Well, I so appreciate that about you because so often people think that the tech people are removed from the bedside and are removed from clinical care. But you've made it very clear that your primary focus is on how we improve care to patients.
Yeah, it's critical really. I think when we're at the table making decisions about how we design things, about how things are displayed, not only thinking about the direct impact from a care perspective to the patient, but also what is the technology feeling like and how will that potentially be received from the patient perspective, knowing that they may be scared, they may be dealing with a new diagnosis or an overload of information related to something that they a few days before hadn't anticipated. And so just really keeping that lens and that perspective, both on how to help the nurses support a patient care as well as help the patients through their reception of the journey. I think that, just remains of critical importance with technology implementations.
Great. So, April, why is it so important now for us to be embracing healthcare technology and innovation in nursing?
I think the pandemic opened everyone's eyes to how challenging things could be. And it's created some ripples that we're still feeling today. I know that the nursing shortage during the pandemic was estimated to be around 30% of need in that area. And while we've seen that figure stabilize some, we're still projected to have nursing shortages of at least 10% continuing on into the next decade or so. And so I think even in addition to just looking at the numbers and percentages of staff, we know our clinicians are burned out and stressed. Patient care is hard. The patients are sicker. They have more complex needs. And, some research estimates that up to 30% of healthcare workers are presently considering leaving the profession. We've got high turnover rates, anywhere from 8% up to 37% across the United States. And, as our patients age and they remain complex in their care needs and the coordination of care, they're going to need more support from us. So, I think the other piece that stands out is that we've got a knowledge gap. We've got a lot of younger nurses that we're happy to support and bring into the profession. But as our nursing population ages out and we have greater percentages of younger nurses, what kind of structures do we have in place, that are sustainable to help foster their growth and make sure that care remains excellent, and that we're taking care of patients in the way that we have designed. So I think, despite all those challenges, we know we've got to continue to provide that high level of care. So it's really just not sustainable to keep doing things the way we've always done them. We've got some opportunities that have come up recently with virtual care platforms, artificial intelligence. Everyone's hearing about that in the news. And we've got the way to really harness the power of some of this new technology to relieve some of the burdens that we've been feeling since the pandemic, and even probably before that point, right, with overload of care and the burden of how that feels. So we've got the opportunities to take advantage of that now.
Well, a lot of exciting opportunities, but perhaps I could ask you to help us understand some of the newer advances in informatics and healthcare technology that that really have the potential to help us address some of these challenges that we're facing in healthcare and make work easier.
Yeah, we've seen recently a lot of health systems focusing in on documentation burden. So I would say that's work with some new tools that happen to be available in that space, that where I see a lot of people going and trying to wrap their hands around it. So I think one of our biggest projects was related to what we called our documentation revamp project at Johns Hopkins, where we asked the nurses for feedback and then translated their frustrations into improvement opportunities that we built into our electronic health record. For example, we added tools to the health record like macros, which essentially allows the nurse to press a button and then it fills in several documentation rows for common repetitive documentation elements to save the nurse time. We've also worked to automate care plan documentation, which has felt redundant to nursing for years. And now we've built in a way for that to be automated so that it will automatically add certain elements to the patient chart and pull documentation into reports, so that we're asking the nurse not to have to document things again, but to really work smarter, more efficiently as it relates to that. So we've definitely seen a lot of movement in having tools that allow us to do that. I think another huge example that everyone's been hearing about is artificial intelligence. In particular, one thing that we're using at Johns Hopkins is ambient listening. So essentially, it records the conversation between the clinician and the patient. And then the technology analyzes the transcript of that and drafts that into documentation. Then we have the clinician reviewing that and saying, hey, I need to edit this, add a little bit more, or this looks good as is. And they can go ahead and save that in the record instead of having to sort of stop and cognitively think and go back through independently and put that energy into the documentation. So our providers have been using that technology for a while now, and we're getting ready to embark onto a pilot with nursing this fall to understand the impact that this technology also has in reducing documentation burdens for nursing. So we know that the docs have said this technology really helps reduce their cognitive load and helps them practice more efficiently. They feel like when they leave their shift, they don't feel this sense of just total and complete mental exhaustion. And so we're really excited to see how that may translate into our nursing staff as well. I would say one other thing stands out, and in advancements in technologies, and that is virtual nursing.
Well, I want to talk to you about that, but I'd actually like to go back for a second and ask you, how has the use of ambient listening impacted the relationship between the providers and the patient?
That's a really great question, and that's something that was very positive that came out of the provider feedback from that. Before the provider was standing at the computer, entering information in as they went, sometimes with their backs or their sides facing the patients. And some of the feedback that we've gotten pretty routinely from our providers now is it allows them to truly engage in that face to face moment. They feel like their connection with the patient is deeper, that they have better opportunities to really hear them, to really truly listen to what they're saying and respond in a more involved way than they had in the past, where maybe they were just thinking about the next documentation element or the next field that had to be filled out on the computer screens. So definitely some positive feedback from them in terms of how that's translated as well. It's a great question.
Well, and that's wonderful because, obviously we know from our nursing colleagues that the quality of the relationship between them and the patient is hugely important. And they complain when the busyness of healthcare gets in the way of those those meaningful relationships that they have with their patients.
Yeah, I think when we started putting electronic health records into systems, we were so excited about everything we could possibly collect and how we could report on all that data, and we were trying to do the right thing. And so we built so much in that then all of a sudden we once we actually got started using electronic health records and realized, "Oh my, what have we done to ourselves?" Right? This overwhelming burden of collecting all this information. Is this truly information we need to collect? Will it really change the outcome for the patient?
Mhm.
Who are we collecting this for? Where's the benefit there? And now we've really done sort of a full circle here. And now we're looking at it at what's the most essential information? And then how do we bring joy back to the bedside and to the patients as well through those encounters? And where's that happy balance?
Yeah. Well, April, let's go back to virtual nursing because I know we're both interested in that. And recently, you've been overseeing the rollout of virtual nursing at 4 of our hospitals. So, could you start by telling us what you mean by virtual nursing, what it does, and what it doesn't mean, both for nurses and for patients?
Yeah, happy to dive into this conversation for sure. A virtual nurse is basically an experienced nurse. Typically, that person works directly on the unit where they will be providing virtual care, and they are responsible for delivering care remotely. So, for Johns Hopkins, this means that nurse will provide care from an office space that is located internally at each hospital, but it is away from the nursing unit. We call that our Hive, which or JHIVE, which stands for Johns Hopkins Integrated Virtual Environment. And from the Hive, they have access to patient technology that is in the room. There are cameras, speakers, microphones, really sophisticated technology that allows us to see into the room at night. And then that technology integrates with the TVs in the patient room. And the virtual nurse from the Hive, from their station, they have 4 monitor screens, headsets, a computer, so they can actually launch virtual visits into the patient room with that technology. They typically do that during the admission process, discharges. They use it for patient education. We found that very quickly, the virtual nurse has said, "Hey, we want to do more things with the patients. How else can we interact with them? What else can we do?" And so we very quickly expanded their role. We've only been live for 2 months now in most cases. I think the first unit went live on in the end of March. So we're still pretty new in the space, but it's been really nice because even though they are remote, they're still able to deliver that personal touch of care to the patient. And so the virtual nurse has a doorbell that they ring into the patient's room. They introduce themselves to the patient and they ask for permission if it's a good time to enter the room. And then once the patient gives them that approval, the camera turns on. The patient can see the virtual nurse on the screen, and then the camera redirects its facing to the patient so that they can tell that the system is on and functional at that time. So you mentioned what does virtual nursing mean and what it doesn't mean. And it was very interesting in this project, just some of what the terminology virtual nursing means to patients and nurses. So, when we were going live with this technology, obviously we had been invested in the project. We had defined what is a virtual nurse, what does a virtual nurse do. But going into a room and saying to a patient, "Hey, we have virtual nursing now," the way that they conceptualized that was pretty fascinating to me. There was a lot of questions of, well, I don't know if I want a virtual nurse. Is it an avatar? Is this someone who's going to be located in another country who doesn't work on this unit? So there was this sense of virtual being either extremely far away and therefore that person would not be in touch with the way that we deliver care at Johns Hopkins, or that it wasn't a real person at all. And so we had to really adjust our scripts with families and patients so that we would tell them out of the gate so that they had a good understanding of what the platform was. And I think on the flip side of that, what we heard from bedside nurses is they felt like the virtual nurse was going to be watching them, monitoring them, critiquing them, that it created a chance they may lose their jobs. Maybe we would start to have more virtual nurses and less bedside nurses. And this was all fascinating to us, of course, because that was not in our design. That was, definitely not our intent of this program or the way that we approached that at all. So definitely through this implementation, we've learned better ways to communicate about it, and then make sure that we incorporate that into next phases of go live and implementation and training new folks to the program because we've learned as we've gone in this regard.
Well, you certainly generated a lot of excitement around this, and as I go between the hospitals, I'm hearing them discuss how excited they are about this launch. But it's change, right? It's change, and change is always frightening for some people. So, what have you been doing to reduce those inevitable stresses associated with practice change, and also to generate buy-in for virtual nursing within nursing staff specifically?
Yeah, that's a great question. And I think it's always something that needs to be very seriously considered at the start of any big technology project. I would say that overall, the feedback we've gotten from bedside nurses and virtual nurses has been incredibly positive about the new platform. And I think that is from the fact that we intentionally recruited and included bedside nurses, patient and family advisors, nursing leaders, quality representatives, our IT partners, educators, anyone that we could possibly think of that would be impacted or influenced by this new technology and the new workflows in any way. We invited them to the table day one as part of our design and build processes to make sure that whatever decisions we were making the right ones to the best of our ability directly out of the gate. We wanted this to be intuitive for nursing, for the virtual nurses that had to learn how to use technology and incorporate some new processes, and also for the bedside nurses. We wanted it to be as least disruptive as possible to what they were used to in terms of ways of delivering care. And so I think that piece was really of critical importance. The very first kickoff to this project that we had, we invited over 180 people from the whole health system, anyone that you could think of that was involved in any way, shape, or form in patient care and supporting patient care. And we had a huge conference where we kicked things off. We explained what virtual nursing was, and we asked them for feedback. We broke up into work groups, and we really started to map out our vision for what this would look like before we even knew a lot about the direction where we were going or a lot about the technology. So again, I think that critical piece of having everybody at the table definitely increased the buy-in and let people know what to expect here. I think in terms of supporting the project itself, with any technology implementation, we have implementation support. But then I think one thing that's continued that has really been pivotal and probably will be with any innovative or disruptive technologies in the future is the idea of ongoing operational partnership. So this isn't the kind of technology where you install it and you support it and then you're like, okay, I'm done. I'm moving on to the next thing. I mean, we really have had to work together with our nursing leadership team, with our virtual nurses, our bedside nurses, to understand how the impact is of having this new way of delivering care. It's not just technology, it's also the way that we practice as nurses. That has changed. And we're continuing to evaluate that to see how we can keep doing that better. We found pretty quickly that the virtual nurses said, hey, we're ready for more things. Give us more roles and responsibilities. And so we started to interview bedside staff and leadership and the virtual nurses and said, what else can we do? What other work is there to be done where we can keep making things easier for the bedside nurse? What other tasks and responsibilities can you help alleviate from that person and continue to work well together with them to deliver care? And so I think because of that, they've been able to see very clearly and at the beginning and then throughout the stages of this, the inherent benefits that it's bringing to the unit, to the patients, to the bedside staff. So that has allowed us to really keep moving on this pathway, which is ever evolving.
Hmm. Well, I think, when people think about virtual nursing, I think a lot of nurses think about work shifting and who's going to be doing what. But perhaps we could just touch back with this with the newer nurses. We've talked in several of our podcasts about our concern with newer clinicians and the levels of anxiety we're seeing in some of our newer clinicians at the bedside. Could you perhaps talk to us about the potential that virtual nursing has to mentor and support and frankly back up some of our newer clinicians as they're growing into their expertise?
Yeah, there are so many opportunities here. We're actually beginning a phase of our project where we will be having some dedicated focus on mentoring. I think we're calling it coaching. What does that look like? And how does that translate into the use of this new platform? So we know that when we look at the literature, there's a ton of benefits for virtual nursing. Patients love it, nurses love it, decreases that sense of burnout, the quality metrics. But I think the biggest wins for nursing really is that renewed sense of joy at the bedside because we are doing some of that work shifting that you mentioned. But I think there's also a piece about safety, which to me ties into this concept of mentoring and coaching, where you know that someone else with a certain level of experience has your back. So that person is an expert in this space, no matter what it is. There's no judgment there, and that idea that there's a way to connect with someone at any point in time where you need support and be able to get that from this role that's always there for you. Even before we did our big kickoff of this particular virtual nursing project, we had nurses in the PICU that developed some virtual support workflows. And so they found benefits from that. And that was limited to just looking at sort of like an online mentoring platform. So I think then the questions become, how do you deliver the coaching and the mentoring in a way that still feels comfortable for the newer person? Because they may not feel comfortable going in the room and saying, "Hi, I'm a brand new nurse and I'm going to have another nurse come in and watch what I'm doing." That you still want to feel competent and that the patient will still trust you. So I think those are the questions that we're starting to ask now is, how do we use this new technology that we have where we can provide mentoring in a way that is comfortable and natural and boosts and supports that new bedside nurse without making them feel scared of feeling incompetent or anything along those lines. So I'm actually really excited to see where this goes and really continue that journey of this virtual nurse being a sense of support for the bedside nurse, whether they're experienced or not, sort of that mental capacity of, I'm here to help support you. I'm going to make sure that everything gets done. I'm going to double check. I'm going to help you do things, but in a positive way, not a I'm watching you, critiquing you kind of way, a beneficial way.
Right, I'm here to have your back. And you were
Yeah.
really describing something which is an environment in which the virtual nurse is part of the nursing team.
Oh, absolutely. We introduced them as being a member of the care team, intentionally on units where we've got whiteboards that we write information on, patient names, patient information on. We include the name of the virtual nurse as part of the care team. And in some of our areas of implementation where they had the resources to do this, the virtual nurse actually rounds in the morning on the units and they have some face to face time with the patients so that the patient can see and sort of have that physical sense of connection with the virtual nurse so that when that person pops up on your television screen later, that's, oh yes, I've already met that person. I know that they're a part of this unit. So we have had to be sort of intentional in some of our design related to that, but they absolutely are a very pivotal member of the care team now in the areas where we have implemented this.
And so is the virtual nurse always a virtual nurse, or do you have situations in which your virtual nurse is virtual some shifts and in person other shifts?
That's a great question. There's a lot of flexibility to this platform. So we may encounter some nurses who have, back injuries that may limit their physical amount of time on the unit. And in that case, that person could work all of their shifts as a virtual nurse to relieve that physical burden on them. May help with retention of older staff members who may have some physical limitations. Additionally, we do see some benefit from nurses who have I would say a certain level of experience so that they can be considered an expert or knowledgeable enough to help provide that level of support that's needed. But that person, once they have that level of experience under their belt, can act and serve as a virtual nurse. We've got a really nice education program that's been developed with some mentoring and some time with hands-on practice and things like that. And once that person's undergone that level of competency, then they can take on shifts. What we see a lot of our units doing is we may have someone that works as a virtual nurse for one shift a week, and maybe their other two shifts a week are bedside shifts. And all of our virtual nurses essentially were nurses that came from the units where we implemented the platform, so that we knew that there would already be a sense of trust from the bedside nurses with that person that's serving in the virtual nursing role, as well as the opportunities to be able to answer questions about the workflows on the unit and physician orders and those kinds of things. So that was a very intentional part of our design to make sure that person could be seen as that resource and that have comfort in that person being a part of the unit team.
Great. Well, as you've been talking, April, I mean, the connections to well-being have been very clear to me. You mentioned the reduction of cognitive load. We've done podcasts on that. You mentioned joy of work. We've done that. You've talked about safety. We've done that. But perhaps we can transition much more specifically now as we get towards the end of the podcast to talk about what are the well-being impacts of not just virtual nursing, but technology, and what is the potential then of virtual nursing and these other technologies to not only reduce burnout and fatigue, but also really support professional fulfillment and renewed joy.
I think we've got a lot of opportunities with taking a look at some of these newer technologies and identifying, to your point, not just relieving the burden of the work, but also helping us achieve excellence in the way that we practice, bringing information, collaborating with what the information that's in the system, bringing that forward, putting that to the front of our ability to practice, and making it more intuitive and easier to pull the information that we need to provide that excellence in the level of care. So I think there's opportunity in that space for sure. I think we are also going to be looking at not only the technology but the way that we practice and deliver care. And that's one thing that's really becoming apparent when we implement these measures. We can't just put a piece of technology in, whether it's software or a new piece of hardware. We have to actually consider how the nurse will integrate this, and it may involve changing workflows. So for virtual nursing, instead of the bedside nurse doing all of the admission documentation, it was, well, we're going to parse this work up and the physical stuff will be done by the bedside nurse, and the administrative work and the screening documentation that'll be done by the virtual nurse. And so I think we're really going to have to lean into that space of really evaluating not only the technology but the workflows, because there are so many efficiencies that can be gained. I think quality and value can be gained simply by having the right information in the right places at the right time, where we're making decisions and we're also seeing what is the next level of care that we have to provide for this patient. So I think in the hospital, outside of the hospital, we're going to have continued opportunities to really see how these types of technology can make a difference and relieve not just the burden, the cognitive burden, but then also I think some of the stress of remembering to do everything and be the best you can possibly be. Some help in that regard as well.
One of the things we talk about in well-being all the time is one of the biggest predictors of our resiliency as human beings is that sense that we have real connection to other people and that they have our backs. I remember early on when the EMRs were introduced, the electronic medical records, talked so much about how the electronic medical record had damaged the connections. And so even though we often would say, technology is getting in the way of good connections with people,
Right, right.
what you described earlier on didn't seem like that was true if it's done well.
I do feel like we're seeing more opportunities in this space as it relates to technology. I think what we've seen is that, at one point in time, I remember estimates as high as 35% of a clinician's time was spent documenting. And so the focus at that point was the clinician facing the computer, focused on work that had to get done. Not that it wasn't important work, but it took away from that element of connecting with the patient that you mentioned. And so I think then it became clear really quickly that that was a burden. And now there are companies, and with the onset of new technology like artificial intelligence, there's a renewed focus on how do we work in a way that provides relief and that makes it easier so that we're more efficient, more functional, and then also performing in a better way, and especially as it relates to connecting with patients. So I know in particular for virtual nursing, patients have expressed to us that they feel that the virtual nurse is not rushed, that that person has time to answer all of their questions. And that's part of the reason why we're seeing patient satisfaction scores skyrocket in places that have implemented this kind of technology. Because the bedside nurse usually has multiple patients. They've got alarms going off. They know they have to go give pain medicine to a patient down the hall. They have a patient that's getting ready to get discharged, and the transporter has shown up, and they have to go in the room and facilitate that. And I think it's that sort of that sense of interruptions and the chaos, which is the normal part of being a bedside nurse, that makes it hard to really be that calming presence that has that time that can really dedicate. And the patients pick up on that too, right? That the bedside nurse feels that way. So we're definitely seeing the benefits. And from the patient perspective, that's the feedback they're giving us is we love the calm perspective, the time that's dedicated to us from the virtual nurse. And then on the flip side of that, from the bedside nurses, we're hearing we actually have time to do more hands-on care. We have time to do things that we haven't been able to do in a really long time, and to put more time into things that matter, maybe focusing on some of our quality metrics and measures more. And so I think it's on both sides of the fence. We see that sense of relief and appreciation for the time that's being given back to the bedside nurse as the virtual nurse takes on some of that role, and that on both sides they feel like they have the better ability to connect, to be more present, to be more hands-on with patients. And I think the overwhelming benefits of that we'll continue to see as we, evaluate the metrics. And, we have the tools now to give us back time to engage with the patients in a better way than we've had in the past.
Right. And then, of course, reduction in those interruptions at bedside are not only going to reduce the cognitive load, but they're going to reduce the safety risks as well.
Absolutely. Yeah, absolutely. I forget what the statistic is that I saw recently, but for every so many interruptions in care, it almost doubled or tripled the amount of risk of there being a patient error that actually occurred. So
Mm.
I definitely agree with you on that front.
Right. Well, April, it's been wonderful talking to you. And before we wrap up, I'd just like to offer you the opportunity to share any last thoughts or words of wisdom with our listeners about information technology or virtual nursing.
I think one thing that I would say that's pretty important as we move into this space where we hear more about our artificial intelligence software and new technologies. Sometimes there's a fear, in particular of the bedside nurse, and even from some of the informatics nurses I've worked with, they feel like maybe I shouldn't be a part of this work because I don't have experience with artificial intelligence or with this new technology. And I would say, from my perspective, the opposite is true. We really need people that are workflow experts and experts in their subject matter expertise, experts in being a nurse, experts in being a leader, that all that representation needs to be at the table because we're going to be innovating and designing new ways of delivering care to work with this technology. And those are exactly the kinds of experts that we need to have sitting at the table with us. So I would just encourage anyone, even if there's a level of fear or a sense of, I haven't done this before, really encourage people to embrace it and just jump in and get involved in the work, because everything that you have from a knowledge perspective is invaluable to make sure that we build and design these things in the right way so that we're getting that maximum benefit back from a well-being perspective and a safety perspective, and all of the things that we're working so hard to achieve.
Well, April, thank you so much. This has been such an interesting conversation. And I'm sure our listeners can hear that you are this very inspirational and high energy person. We're so lucky to have you with us at Johns Hopkins. And I hope perhaps at some point you'll come back and talk again about some of the lessons you've learned as you've rolled out more broadly across our health system.
Yeah, that would be fantastic. I am super excited about the work that's happening in this space. And the more we can learn and share with each other, the better things get. So would love and welcome that opportunity. Thank you so much, Carolyn.
And thank you, April. And thanks to everyone who's been listening. We hope that you enjoyed our conversation today and that you'll come back soon and listen to another one. So that's it for today. If you enjoyed what you heard, please share this podcast with a colleague. And as always, we welcome your feedback.
If there are any topics you'd like to hear about, please email us at owb@jhmi.edu.